Next, coming to the antiviral agents. Now, in the antiviral agents, we have three different categories: the anti-herpes virus, the anti-retrovirus, and the anti-influenza virus. So, we are going to quickly see what are the different mechanism of action of these viruses, how do they act, and individually we are going to see few important drugs. Now in the antiretrovirus, you can see over here NRTIs and NNRTIs. So NRTIs are the nucleoside reverse transcriptase inhibitors. NNRTI is the non-nucleoside reverse transcriptase inhibitors. And these are the third category is the protease inhibitors. So first we are going to see about the Acyclovir, which is classified under the anti-herpes virus drugs. So Acyclovir gets converted to acyclovir monophosphate with the help of using the enzymes from the herpes virus. It is an anti-herpes virus drug. So it takes the advantage, it takes the use of the enzyme which is produced by the virus itself. The drug takes the advantage of the enzyme which is produced by the virus itself and gets converted into acyclovir monophosphate. And then with the help of kinases, it gets converted into acyclovir triphosphate. Now this acyclovir triphosphate is the active form of the drug. This triphosphate inhibits the herpes virus DNA, and also it gets incorporated into the viral DNA and stops the DNA strands or terminates the formation of DNA completely. So the importance of this acyclovir is it is taking the advantage of the enzyme which is produced by the virus and getting itself converted into the active form. Once it is in the active form, by two mechanisms it inhibits the synthesis of DNA by inhibiting the polymerase enzyme and by terminating the DNA synthesis. Now this antiviral drug, that is the acyclovir, is used in the conditions of oropharyngeal herpes simplex and herpes labialis conditions of the mouth, which are usually seen in immunocompromised patients, the patients whose immunity is less. And also it is important for the dentist to know the risk of accidental exposure to HIV, and they should also know the prophylaxis. What is the prophylaxis and preventive measures of HIV infection? So this is about the anti-herpes simplex drug, that is the acyclovir. So this is the same mechanism. It acyclovir triphosphate is the active form and it interferes with the DNA polymerase enzyme and it inhibits the synthesis or replication of the DNA, resulting in the termination of the synthesis of DNA. However, this drug is partly absorbed from the gut. The next category is the anti-retrovirus drugs. Now these, before we understand the mechanism of anti-retrovirus drug, we should first know the mechanism by which the HIV virus is replicating. How is it dividing itself? So if you see, this is the normal human cell. Now, how this virus is entering inside the cell, what is it doing inside the cell and how is it leaving the cell. This is the basic mechanism by which a virus infects, the HIV virus infects the cell. In the middle, we will see how the drugs are acting on different stages of this viral replication. So first you can see here the HIV virus attaches to a helper T cell. Helper T cell is nothing but the one of the type of the WBCs which is responsible for immunity of the body. Right. So the virus gets attached to this T cell through proteins which are known as CD4 proteins. When it gets attached to it, the viral RNA and the enzyme reverse transcriptase, they are slowly entering the cell. So with the help of attaching itself to the T cell, it gets incorporated into the human cell. Now from there what will happen? The reverse transcriptase enzyme plays a very important role. This enzyme, it makes a copy of the viral RNA. So it makes a DNA copy of the viral RNA. Now this enzyme is actually responsible for duplicating the viral RNA and making a DNA copy of it. Once the viral DNA is formed, then that DNA goes and attacks the nucleus. And in the nucleus of the normal cell, the viral DNA replicates. After replicating, it will try to produce more HIV proteins. And when these proteins are produced, another enzyme, that is the protease enzyme, it cuts the protein into their proper sizes to make it useful. Then these particles are all assembled together and the cell, the normal cell which they have infected, will be killed and the virus will leave the cell and it will go and attack the new cell again. So this is the mechanism by which the HIV virus replicates. So in this process, you can see that there are two important enzymes which are actually playing an important role. The first enzyme is the reverse transcriptase enzyme, which is helping to form or duplicate the viral RNA and form a viral DNA. Then that DNA enters the nucleus and cause all the damage. And when the proteins are formed, another enzyme, the second enzyme which plays an important role is the protease enzyme. This enzyme then cuts the protein into proper sizes to make it useful. Then they all are arranged together and it kills the cell and leaves the cell and infects the new cell, and again the same cycle is repeated. So we have the drugs which are acting as the antiretroviral drugs, they have to inhibit the reverse transcriptase enzyme and they have to inhibit the protease enzyme. So because these two enzymes plays an important role in the replication, these two enzymes has to be targeted. So that is why the name over here in the classification is nucleoside reverse transcriptase inhibitor, non-nucleoside reverse transcriptase inhibitor. So these two category of drugs, they inhibit the reverse transcriptase enzyme. Mechanism is different, that is why they are known as nucleoside and non-nucleoside, but they are inhibiting the enzyme reverse transcriptase. The third one is the protease inhibitor. So protease enzyme, you know, it is responsible for cutting down the proteins. So protease inhibitors, reverse transcriptase inhibitors. Within the reverse transcriptase, there are two types: nucleoside reverse transcriptase non-nucleoside reverse transcriptase inhibitors. Now, if you see the mechanism of the nucleoside reverse transcriptase inhibitors, I have explained it with the help of an diagram, so it will be easy for you to understand. Now you see, this is the viral RNA. This is the enzyme. Imagine that this is the reverse transcriptase enzyme. Now this enzyme is having a site where from where the viral RNA is passing, and simultaneously this reverse transcriptase is able to duplicate the viral RNA and produce a viral DNA. So with the help of this binding site, it is using the viral RNA and forming a viral DNA, duplicating it as a viral DNA. Now, what is the mechanism of the reverse transcriptase inhibitor? The nucleoside reverse transcriptase inhibitors, it is inhibiting the DNA chain and terminating it, and it is not allowing it to come in contact with the reverse transcriptase. So basically this inhibitor binds to the DNA chain and terminates it. So that is one of the mechanism by which the reverse transcriptase inhibitor is acting. Which one? The first one, the nucleotide reverse transcriptase inhibitor. The second one is causing a modification in the reverse transcriptase binding site. So you see here, over here, this is the binding site through which the viral RNA is actually passing, and it is able to read it and duplicate the viral RNA as a viral DNA. Here, the non-nucleoside reverse transcriptase inhibitor, it is binding to the enzyme, and it is causing a modification in the binding site. It is making it something different through which the viral RNA is not able to pass. Once the viral RNA is not able to pass through or go through the reverse transcriptase enzyme, then what will happen? It will fail to form the duplicate viral DNA. So both of them are inhibiting the reverse transcriptase enzyme, but the mechanism is different. The first one is directly terminating the DNA chain. The second one is causing modification in the enzyme, so that the enzyme is not able to make a copy of the viral RNA. So this is the mechanism by which they are acting. The example which we are going to see here is Zydovidine. This is the example of nucleoside reverse transcriptase inhibitor. Now it is used for the treatment of HIV disease, whether the disease is symptomatic or asymptomatic. So whether it is showing symptoms or not showing symptoms, Zydovidine is useful, and it is used for halting, stopping or delaying the progression of the disease and prolonging the life of the HIV infected patient. So it will try to delay as much as possible the infection in a HIV positive patient. Of the adverse effects, the serious adverse effects are neutropenia, convulsions can be seen, encephalopathy can be seen, and apart from that, nausea, vomiting, headache, abdominal pain, etc. can be seen in people who are undergoing treatment with Zydovidine. One more example is Lamivudine. The importance of Lamivudine is it is used prophylactically in healthcare people who are at a risk of acquiring HIV infection. So all the doctors who are at a risk of acquiring the HIV infection, for those people Lamivudine can be given as a prophylaxis. If the person is exposed, then it can be combined with Zydovidine for the treatment of HIV infection. The third category is the protease inhibitors. So as I told you, what is the function of protease enzyme? The protease enzyme helps to cut the protein into proper sizes to make it useful, right? So protease inhibitors are those drugs which inhibit the protease enzyme. Now these drugs are having more advantage when compared to the other drugs because these drugs are acting on the protease enzyme, and that protease enzyme acts in the late stage of the replication. So even if the cell is newly infected or if the cells are chronically infected, both of them can be attacked with the help of protease inhibitors because protease is acting in the last stages of the replication. If you compare protease inhibitors with nucleoside inhibitors, the nucleoside is acting in the early stages. So once the cell crosses that stage, then the nucleoside inhibitors are of no use. But the protease inhibitors are useful for the newly infected cells as well as the already infected cells if they are just near the protease enzyme, near the stage of the protease enzyme. So that is the importance of the protease inhibitor. Next is, as you know, it binds to the protease molecules and it causes the, it interferes with the cutting of the protein. And in dentistry, the protease inhibitors, the plasma levels of protease inhibitors are increased by another drug such as lidocaine, which can be used in which is used in dentistry, metronidazole, carbamazepine, etc. So these are the importance of protease inhibitors and the drug interactions of protease inhibitors. Next, coming to the treatment regimens of HIV infection. Now, these are the different treatment regimens of HIV infection, the preferred regimen to combine these drugs and alternative regimen to combine these drugs. So what we have to focus is the low risk and the high risk infection. Low risk infection and high risk infection, in both of them the patient is HIV positive, but in low risk the patient is asymptomatic. Why? Because the HIV RNA titer is low. What is HIV RNA titer? In simple word, it is known as viral load, the amount of virus or the quantity of virus per ml of the blood, we can say. That is the viral load. So, in the low risk people, they are HIV positive, but they are asymptomatic. They are not showing any symptoms because the viral titer, HIV RNA titer is low, and the CD4 cell count. CD4 cell count are the cells which are having immune response, right? So these cells are more. That means the cells are trying to fight. The immunity of the body is more when compared to the actual virus present. So these are known as the low risk HIV people. How they are exposed? They are exposed through superficial scratch or a needle or through mucous membrane, etc. High risk people are also HIV positive, but they are symptomatic. They are showing symptoms, symptomatic AIDS patient. And why are they symptomatic? Because their viral load, the HIV RNA titer load is very high and the CD4 count is less. That means the virus is more than the body is trying to fight it. And this type of high risk is developed when a major area has come in contact with the HIV virus, okay, or for longer duration, major area has come in contact or the area has come in contact for a longer duration, okay, large needles, deep puncture, patient's blood is on the needle, like that. So all this is the low risk and high risk people. So what is the difference between the low risk and the high risk? You must know. So this is about the antiviral agents.